That constant grinding ache in your lower back is not just a sign of getting older. It's a critical warning signal from your body's core that a foundational structure is failing. Deep within your pelvis, a powerful group of muscles may be actively pulling your spine into a state of permanent crisis, setting off a chain reaction that could compromise your mobility for life. This is the story of the silent aggressor you've never been told about, the iliopsoas muscle group, your body's deep hip flexors. As detailed by medical experts at the Cleveland Clinic, this isn't a surface-level muscle. The psoas major originates from your lumbar vertebrae, your lower spine, travels through the pelvis, and attaches to your femur. It is the only muscle that directly connects your spine to your legs. It is your structural linchpin, and when it tightens, it doesn't just cause stiffness. It physically yanks on your spinal column, 24 hours a day. The modern world is the perfect breeding ground for this dysfunction. Every hour you spend sitting in an office chair, a car, or on the couch forces your hip flexors into a shortened, contracted position. Over years, this becomes their default state. The muscle tissue adapts, losing its elasticity and becoming dense and fibrotic. This constant, vice-like grip pulls the pelvis into an anterior tilt, creating an exaggerated curve in your lower back and compressing the delicate vertebral discs, the shock absorbers of your spine. This structural failure triggers a devastating cascade. The compressed discs can bulge, impinging on major nerves like the sciatic nerve, sending pain shooting down your leg. The constant muscle tension restricts blood flow, starving surrounding tissues of oxygen and nutrients and creating a localized pocket of chronic inflammation. This inflammatory state doesn't stay local. Chemical stress signals are released into your bloodstream, contributing to systemic inflammation, a known driver of numerous chronic diseases. Your gut and diaphragm function can even be affected, as the psoas is neurologically and physically linked to these core structures. Reversing this damage requires a direct, multi-pronged assault. This is not about generic stretching. It's about precise, targeted release protocols. First, the kneeling hip flexor stretch. Perform this twice daily. Kneel on your right knee. Place your left foot forward with the knee bent at 90 degrees. Crucially, you must posteriorly tilt your pelvis, tucking your tailbone under to isolate the psoas. Hold this for 30-45 seconds, breathing deeply. Do not bounce. You are retraining the muscle's resting length. Second, you must break the cycle of sitting. For every 30 minutes of seated activity, you must stand and perform 10 glute bridges. Lie on your back, knees bent, and drive your hips to the ceiling by squeezing your glutes. This reactivates the opposing muscle group, sending a neurological signal to the hip flexors to relax, a principle called reciprocal inhibition. This two-step process directly counteracts the shortening caused by sitting and begins to restore proper pelvic alignment. Your mechanical reset must be supported by nutritional warfare against inflammation. You cannot stretch your way out of a pro-inflammatory diet. The final, critical protocol is to systematically remove inflammatory agents and flood your body with powerful anti-inflammatory compounds. First, you must eliminate all industrial seed oils, soybean, corn, canola, which are high in inflammatory omega-6 fatty acids. Replace them with 1 tablespoon of extra virgin olive oil daily, rich in the anti-inflammatory compound oleocanthal. Second, consume 4 ounces of wild-caught salmon or mackerel 3 times per week. Their high concentration of omega-3 fatty acids, specifically EPA and DHA, directly resolves inflammatory pathways at the cellular level. Third, incorporate 1 teaspoon of turmeric combined with a pinch of black pepper into a meal each day. Curcumin is a potent inhibitor of NF-κB, a key protein that activates inflammatory genes. Avoiding processed sugars, refined grains, and seed oils, while strategically adding olive oil, fatty fish, and turmeric, provides your body with the raw materials needed to extinguish the inflammatory fire your tight muscles started, allowing the tissue to heal and remodel.